Good evening, everyone. My name's Richard Cohn. On behalf of my father, Dr. Herbert Cohn, my brothers, Dr. Jeffrey Cohn and Dr. David Cohn, and our entire family, welcome to the Free Library of Philadelphia and to the Natalie Cohn Memorial Lecture. Medicine is the theme of tonight's lecture. I know it's probably surprising to some of you who know our family that it's taken this long, this being the second annual author lecture being given in Mom's memory, for medicine to claim center stage at this forum as well. But last year we had E.L. Doctorow available, one of Mom's favorite authors, so medicine had to take a back seat for a year. Bit of housekeeping first. Please take a moment to silence your cell phones. Also, please remember that no flash photography is permitted during tonight's event. Following the event, a book signing will take place upstairs in the lobby. And please don't forget that most of the library's author events are also offered as podcasts at freelibrary.org. From its award-winning author event series to its thought-provoking programs and life-changing resources for all ages, the Free Library is dedicated to advancing literacy, guiding learning, and inspiring curiosity. Many of the library's most beloved programs and services are made possible only with the help of private support. Please make a gift of whatever amount you are able to give to help the Free Library transform lives. You can do so online at freelibrary.org/support. Mom was, I'm proud to say, an unabashed, dyed-in-the-wool, bleeding-heart liberal. I can remember her carting me around with her in '68 when I was 9 or 10 in her maroon Oldsmobile station wagon with big yellow daisies festooned on one side as she handed out campaign brochures as a booster for Eugene McCarthy. I recently came across one of McCarthy's leaflets from that campaign in which he called for establishing what he labeled new civil rights. One of those rights was, and I quote, "the right to adequate health care without regard to race." That's the kind of thing Mom believed in. Our guest tonight, however, former Secretary of the U.S. Department of Health and Human Services in the George H.W. Bush administration, is proof that compassionate and effective advocacy of improvements in public health need not be limited or defined by party affiliation or political philosophy. One other thing about Mom was that she loved people, loved to learn their histories and unique stories. So Mom would have been thrilled to be here tonight to have the opportunity to learn about the truly remarkable personal journey of our esteemed guest, the distinguished health policy leader, physician, educator, and author, Dr. Louis W. Sullivan. As noted above, Dr. Sullivan served as Secretary of the U.S. Department of Health and Human Services from 1989 to 1993 under President George H.W. Bush. During that period, he spearheaded initiatives to, among other things, improve FDA food labels, educate citizens about the dangers of tobacco, and address the AIDS crisis. Dr. Sullivan was the founding dean and first president of the Morehouse School of Medicine. He has held numerous leadership roles in corporate and nonprofit organizations, including the Association of Minority Health Professions Schools, General Motors, Africare, and the eponymous Sullivan Alliance to transform the health professions. In his new book, Breaking Ground, My Life in Medicine, Dr. Sullivan chronicles his life, from his childhood in the Jim Crow South to his extraordinary work as a physician, policymaker, and health advocate. Breaking Ground recently received the 2015 NAACP Image Award for Autobiography. Dr. Sullivan will be interviewed tonight by journalist Tracy Matisak. It's great to have such an impactful leader here with us tonight, so without further ado, please join me in welcoming Dr. Louis W. Sullivan and Tracy Matisak to the Free Library.
Well, good evening, everyone. Thank you so much for being with us tonight. Dr. Sullivan, what a pleasure to have you with us. I don't know whether all of you have had an opportunity to read Dr. Sullivan's book, but it is a fascinating account of his life, his experiences, lessons learned along the way. And Dr. Sullivan, I think it would be safe to say that you have dedicated your life to making healthcare accessible to those who might not otherwise have the opportunity to have quality health care. How are we doing in that regard in 2015? How far have we come?
Well, there's no question that we have made progress, and we can cite some of the things. For example, since the Affordable Care Act was implemented, we have 11 more people with health insurance, whereas prior to that time, we had close to 50 million people without health insurance. So we've made progress, but we also have a lot more progress to make. So it's a mixed picture, but I'm optimistic, and I think we'll get there.
Earlier this evening at dinner, someone was asking you about the innovations that you've seen in medicine, in healthcare, and what has really impressed you of late. Would you share some of that with our audience?
Oh, yes. First of all, let me say the 20th century has been a remarkable period of innovation in general, and certainly in healthcare particularly. More recently, technology has really exploded in medicine. The electronic medical records, when I was a medical student and even as a physician and professor at Boston University, we had paper records. They were often cumbersome, difficult, they'd get lost. It takes time to get them. Now with the electronic records, you can have information instantly, and it can be transferred around the world within a matter of minutes. So that's one of the many innovations. We have applications for iPhones where we can record your electrocardiogram and can transmit that some 5, 10, 50 miles away to the doctor's office so that you can be in a remote area, but your doctor can really look at your EKG and see if your rhythm is normal or if there's some conduct aberration, et cetera. So those are some of the things. We are really have great understanding of the human genome, the genetic makeup of our cells, and we are beginning to use that information to develop specific personalized medicine, so that the idea there is that we can develop therapies that will be more effective than the usual therapy, whether it's treating you for an infectious disease or for cancer or high blood pressure, and the likelihood of an adverse reaction would be much less because this medicine is specifically tailored for you. So we really have a lot of things going on that makes it very exciting.
I want to talk about your book. Who or what was it that inspired you to get into medicine?
Well, it's interesting. As you know, I was born in Atlanta during the Depression. My father was selling life insurance, and he was going broke because nobody was buying life insurance. So he moved to rural southwest Georgia, where he established a funeral home, the first black funeral home in that town, because in those years of strict segregation, there was one black physician in southwest Georgia, in Bainbridge, 41 miles south of where we lived. My father would take people down there because he provided an ambulance service, and he always would take me with him to help. Well, of course, I'm not sure how much help I was, but I was fascinated with this Dr. Griffin. He could cure people. People who were seen by him were made better. He was very successful. He impressed me. He was always in his green scrub suits. You'd open the door for his clinic, a brick building facility in the small town, be the smell of ether, which is a pungent, mysterious smell. And I was so in awe of him, I said at age 5, I want to be a doctor because I want to be like Dr. Griffin. He was highly respected in the community, and that really was for me the thing I wanted to be. So since age 5, I wanted to be a doctor.
And you grew up in the days of Jim Crow, and you write in the book that even death was segregated in your community.
Yes, prior to my father moving our family to Blakely, blacks who died in this town, either you they would send 60 miles away for a black funeral director to come, or the blacks would be cared for by the white funeral director, but the casket would be taken on the back of a mule-pulled carriage rather than in an ambulance. That was an indignity that many in the black community did not accept. So when my father moved there, he was welcomed in the community. So that was for us at the time when I was about 4 years old. We really learned a lot about differences. My parents would not drink out of the separate fountains. Rather than drinking out of a fountain colored white, we just wouldn't drink at all. We'd wait until we get home because we did not want to accept the system that way.
Your father was quite the agitator, it sounds like, and also had a tremendous influence on your life. Tell us a little bit more about him.
Oh, yes. No, my father really was. First of all, he established the first chapter of the NAACP in this town. He worked to have the white primary repealed, because in those years, in order to vote, you were white. And he worked to get blacks registered to vote. When black would go down to the courthouse to try and register to vote, they would be asked questions about what's the difference between the 13th and 14th Amendment, or other things really designed to embarrass them, such as how many bubbles would there be in a bar of Lux soap? Something that indignant. And the whites thought that was funny. And so that was really the atmosphere then. So my father worked to really repeal that. My mother was a school teacher. And they lived there 20 years, from 1937 to 1957. And because of my father's work, he not only started the NAACP chapter and brought suit against the white primary, brought suit also against the school system because his facilities, while they were separate, they were not equal. And because of that, during the 20 years they lived there, my mother never got a position as a school teacher in that town. She would have to drive to towns ranging from 14 miles to as far as 40 miles away, although she had a master's degree in education. So that was the white community's way of trying to retaliate against my family. But to my parents' credit, they didn't accept this. They always fought, and because they were so committed to my brother, who was a year and a half older than me, to my brother and me getting an education, they sent us away when I was in 5th grade, first to Savannah for a year to live with relatives, then to Atlanta to live with a friend, to attend school, because schools for blacks in rural Georgia in those years were really clearly inferior. So I'm grateful to my parents for their commitment to education, because for me and my brother, it's made all the difference.
Was there ever a point where you doubted that you would be able to become a doctor, given where you grew up, given some of the challenges that you faced? Did you ever have any doubt?
Not at all. Yeah. Not at all. The way it happened, when I was, again, about 5 years old, and I told my mother I wanted to be a doctor, her response was, "Louis, that's great. You'll be a great doctor." So that, looking back on that, that was positive reinforcement. It wasn't, "Gee, are you smart enough?" or "It costs too much," or what have you. But really, I had no doubt. And of course, my parents really taught us to be very disciplined and very focused. And so with that, no, I knew what I wanted to be, and there was never any doubt that I would achieve it.
I want to fast forward to Boston and medical school. That must have been quite a culture shock for you. Tell us about that.
Yes, right. I, of course, went to Morehouse College in Atlanta. Many of you know that this is a black college, really quite distinguished graduates, of which Martin Luther King Jr. was our most famous graduate. But when I was accepted at Boston University and went to Boston for the first time in September of 1954, this was my first time living in a non-segregated environment. And out of a class of 76 students, I was the one black. My classmates were from Princeton, Middlebury, Amherst, Columbia, etc., and most of them had never heard of Morehouse. And so here I was, I wondered, well, now, how am I going to do competing with these guys from these colleges who were known all over the country? And I said, well, gosh, am I going to do well, or will I embarrass myself, or will I disappoint my parents? Will I represent my college well, et cetera? So there was a lot of concerns. Also, I wondered, how would I be received socially by my classmates? Well, the answer to both is there was no problem. The first exam we had about 3 weeks after we entered medical school, and I did very well. So I then relaxed. And also socially, my classmates were very accepting. And after a few months, I forgot I was black. So I was just another member of the class. So I had a great experience, and I really am forever grateful to Boston University, because that was a place where I learned to live in an integrated environment, both professionally and socially, and that has helped me all along the way.
Wow, yeah. Certainly, within the context of Boston University, you had a great experience. You did encounter some difficulties outside of medical school. Tell us about that, about some of the experiences that you had.
Oh, yes. Well, what we found, first of all, I met my wife actually within 2 weeks of going to Boston. She came down to Boston from Pittsfield, Massachusetts, in the far western part of the state. And of course, her mother, she came down to Northeastern University, and her mother sat her down to tell her how to behave in the big city of Boston, because people in Pittsfield looked upon Boston as a city full of danger and vice and temptation, etc. So her mother told her how she should comport herself in Boston. So when my wife Ginger thought she was finished, she stood up, and her mother said, "Wait, sit down. I haven't finished yet. I have one more thing to tell you, and if you don't remember anything else that I tell you, you must remember this. When you go down to Boston, don't get mixed up with any of those Southern boys." Well, 2 weeks later, I was being introduced to Ms. Ginger Williamson. And I thanked her mother for telling her that, because I was kind of the exotic forbidden fruit, and she had to figure out what was it about those Southern boys that she was supposed to watch out for. Well, we got married my sophomore year, and I really discovered that while Boston is a great city, full of history, and of course I was fascinated by Paul Revere's Ride and Concord and Lexington and Boston Harbor, where the Tea Party, a revolution occurred. It's Crispus Attucks, the first black to be killed in the Revolutionary War, with his statue in Boston Common. So I found that a fascinating city. But when we started looking for an apartment, I'd call up and say, "I see you have a place for rent. I'm Lou Sullivan." They said, "Well, come on by." At the time, I didn't realize that Sullivan was the most common name in the Boston telephone directory. And when I got there, somehow I'd ring the bell, nobody would answer. Or I'd see the curtain move. Or I'd be told, "Well, gee, I'm sorry, when we talked with you 15 minutes ago, I didn't realize my sister had already rented the apartment." So I discovered that things weren't ideal, that there was prejudice in Boston, but the difference between, in my view, the South and the North is that in the South, it's open. You knew what you were dealing with. You may not like it, but it was there, and you could try and deal with it. But if you're in an environment where everyone says, "We don't have a problem," then you believe it, and you act, and then you run into something, it's a surprise. So we ran into that. And of course, fortunately for Ginger and me, this was prior to the busing crisis in Boston, which occurred in the late 50s with Louise Day Hicks, a councilwoman who really made her political career in fighting against busing. That polarized the city, which I think was unfortunate, because I can tell you, for many black students who went to Boston in the late 50s or 60s, have a very different view of the city than I did. I found Boston to be, aside from those housing incidents, I found the city to be open, a rich city in history and culture, and so forth. So we ran into problems there. And of course, as I grew up, I realized that there are problems every place. People deal with them in different ways.
Well, and you share the story about how you were successfully able to work through an issue like that with the summer camp.
Yes, that was another instance. When I was doing my hematology fellowship at Boston City Hospital, there was a notice on the bulletin board there in the residents' quarters looking for a camp doctor. So I called up and said, "Hi, I'm Dr. Sullivan. I see you are looking for a camp doctor." And we talked, and they asked about our training, and so they said, "You're just what we need." And so they sent me a contract. There was one thing I didn't tell them. You can guess what that was. So when I arrived up in Damariscotta, Maine, and I was looking forward to this because being a camp doctor, that's easy stuff. You deal with poison ivy, cuts and scrapes, vaccines, etc. And occasionally you might have someone who breaks an arm and you can splint it and send them to the hospital. So for this, I would get a cabin for me and my family. So for me and my family, this was a vacation. So we arrived up at this camp, and the owner was outside of the administrative cabin, and I could tell when I stepped out of the car that we might really have an incident. So he was looking worried. So we went in, and so I told him who I was as Dr. Sullivan reporting to work. And so he said, "Well, wait a minute, let me do something in the back, I'll come back." So he came back out a few minutes later with his wife and said, "Doctor, I think we've made a mistake. We've never had a black doctor or black staff at this cabin. And I'm not prejudiced, but, it's our campers and their families. We don't know how they would react. So we'll pay you the money that you would have earned and we apologize for any mix-up, but we think we can't work this out." And so I wasn't totally surprised by that. So I said, "Well, I have a contract here. I'm here to report. I'm here to perform my side of the contract, and I'm not going to let you buy me off by that." I said, "You want service? I'm prepared to give it." So he went in the back again, and then he came out with an older gentleman, Uncle Zeke, who had been with the camp for a number of years. And so, to make a long story short, he said, "Doc, let's try this, see how this will work out." Worked out. It was great. No problems whatsoever. And by the end of the camp, we were friends. And in fact, my son, oldest son, has two boys now, 12 and 10 and a half. My son takes them to that camp. So that worked out.
It did. Let's go back to Atlanta and talk about Morehouse Medical School and how that came to be, because you certainly ran up against a lot of opposition, a lot of challenges. Tell us how the medical school came to be and some of the challenges that you faced along the way.
Yes, that really is interesting, fascinating period in my life. And I would say this, the way this came about is as follows. As I mentioned, I was trained as a hematologist. When I went to medical school, my view was that I was going to return to Georgia to be a general physician like Dr. Griffin down in Bainbridge. That was my view. But I learned a lot about medicine that I hadn't known before I went to medical school. So I ended up as a hematologist, and not only a hematologist, but a research hematologist and teaching, then became professor of medicine at Boston University. Well, many of you remember that during the second half of the 20th century, we had tremendous expansion of medical education in the country. In 1950, we had 80 medical schools around the country. Starting in 1956, two new schools opened, Albert Einstein in the Bronx and Seton Hall Medical School in Jersey City, New Jersey. They were the first of 47 new medical schools that were opened in the second half of the 20th century, because studies in the mid-50s projected that we as a country were going to have a doctor shortage if we didn't expand the training of doctors. So 47 schools were developed with federal support, primarily from the Department of Health and Human Services, but also the VA supported some 7 of those schools, and the Department of Defense supported 2 of those schools. So we as a country expanded medical education tremendously. Well, in 1950, there were 2 of the 80 medical schools were predominantly African American, Howard in Washington, D.C., and Meharry Medical College in Nashville. And we had a shortage of black physicians. Only 2% of the physicians in the country in 1950 were African American, whereas blacks at that time were about 10% of the population. So with the expansion that was underway for medical schools, there was a study done by the Georgia Department of Health that showed that Georgia, with 28% of its population being African American, only 2% of the physicians in Georgia were African American. So Dr. Louis Brown, a black physician in Atlanta, brought this study to the presidents of Morehouse College and convinced him that Morehouse should undertake the development of a medical school. They formed a committee of college alumni, which included me, the college alumni who were in academic medical positions around the country, to advise the college on this. So we worked for a year, and we, after being initially skeptical, we were convinced that it was doable and was exciting. So then when they began to search for a dean to develop the school, then that's when they offered me the position. And by that time, I had already decided that while I had been very happy with my career up until that time as a research hematologist and teaching students, et cetera, I thought the opportunity to develop a new institution with the need that we had would be very exciting. So I went back to Atlanta to found the Morehouse School of Medicine, and it happens this year is our 40th anniversary for the school. And it's still a young school, but already we've produced a Surgeon General, Dr. Regina Benjamin, one of our alumni. We've produced the president of another medical school. We've had one of our graduates who is from South Africa, who went back to South Africa and developed the first nationwide blood banking system in South Africa, modeled after the U.S. Red Cross blood banking system. And I was in South Africa in October of 2010 and saw him, and they were celebrating the completion of their first year of operation without a single case of HIV or hepatitis C being transmitted by contaminated blood. So I'm proud of our graduates, and we were also listed in a paper in the Annals of Internal Medicine, the Journal of the American College of Physicians. We were listed as the school with the strongest social mission of all medical schools in the country. Graduates who are going into rural and inner city areas, pursuing careers in primary care as family physicians, pediatricians, internists, et cetera. So that really is how that happened. And so I've had a complete shift from being a researcher to being an administrator, fundraiser, visionary, and of course that led to other things.
Well, yes, speaking of complete shifts, then how did you go from being in academia to being in politics?
Well, the way that happened is this. One of the things that happened that I was exposed to at Morehouse College was our president. We had a phenomenal person as our president. His name was Benjamin Mays. Martin Luther King Jr. Felt that he was like a second father to him. Dr. Mays had his own special story. He was born in rural South Carolina and ended up hitchhiking to Bates College in Maine and finished valedictorian in his class in 1906. Later, PhD in philosophy and religion from the University of Chicago. And so he became a minister and an administrator, but he was an eloquent speaker, person of great integrity, was always impeccably dressed. So all of us as students, we wanted to be like Dr. Mays. So that was our role model. Well, when I had the opportunity to develop the Morehouse School of Medicine, the same value system that I was exposed to as a student at Morehouse College, we tried to inculcate at the medical school. We was started by the college with our first class admitted in 1978, and in 1981, as the school had developed, we became separate from the college, and that was part of the plan that had been developed. The first instruction started on the campus of the college, but our first building for the medical school was dedicated in July of 1982. The speaker for that was then Vice President George H.W. Bush. The program was 9 o'clock in the morning. He was supposed to be in New Orleans to speak at a luncheon that same day, so we were told that he could stay only about 10 or 15 minutes. Well, he stayed an hour afterwards. Pictures were being taken with John Lewis and Andy Young and all these members of the black community, Democrats, et cetera, but they were having a lot of fun. So when he left, his aide pressed something into my hand, so the Vice President wants you to have them. They were a pair of cufflinks. I didn't know that there was such a thing as presidential cufflinks at the time. But 2 weeks later, on a Friday, I was trying to finish some things before the day was over, and my secretary buzzed me saying, "The Vice President's on the line." I said, "What Vice President?" She said, "How quickly we forget." I said, "Oh." Well, it was Vice President Bush. He told me that he was planning a trip to sub-Saharan Africa in November of that year, and he would like for me to be part of his delegation. So I said, "Well, gosh, Mr. Vice President, I would be honored, and I'll see. I think I can arrange my schedule here, but since I'm not in the government, what would my role be?" So he said, "Well, Lou, to be honest with you, we don't have an Andy Young in our administration, and this will be the first visit to sub-Saharan Africa of a senior member of the Reagan administration, and I can't go to Africa without some prominent African Americans in my delegation. So you do me a favor, but more importantly, you do the country a service if you'd be willing to go." And I appreciated his honesty. And I went on the trip. First of all, it turned out to be a fascinating trip. But also on that trip was Barbara Bush. And so while Vice President Bush was meeting with the heads of state, Barbara was talking to adult literacy groups all over Africa, in Zaire, in Zimbabwe, in Senegal, et cetera. And so after 2 weeks traveling over sub-Saharan Africa, visiting 8 countries, on the way back, I told Barbara, I said, "You know, Barbara, you and I are in the same business. You're in adult literacy education. I'm in medical education. We are a young school. We have a lot of development needs. We need to have someone like you on our board. Would you be willing to serve on our board?" So she said, "Well, Lou, I don't know. I'll have to really talk to the White House counsel before I do anything like that, but let me talk to them and I'll get back to you." Well, I thought, gee, this is a very nice, smooth way to be dismissed. So I thought that was the end of it. And this was Wednesday, the day before Thanksgiving. In 1982, we returned to Andrews Air Force Base from sub-Saharan Africa. Well, she called the following Tuesday. She said, "Lou, I can do it." So she came on our board in January of '83 and served until January of '89. And she was a working trustee. She missed one meeting in that 6-year period, and she helped us launch our first national fundraising campaign for the medical school. And in that 6-year period, my wife and I were frequently invited to the Vice President's home for various functions, and we got to know the Bushes very well. So when he was running for president in 1988, I held a reception in Atlanta, primarily to introduce him to the black community, because we felt the black community really didn't know him. And of course, I had another part of my agenda, because one of my trustees had been a finalist to be Secretary of Health and Human Services in 1985. He didn't get the job, but he was one of 3 finalists, and he still wanted to serve. So my agenda was to have Bush in the White House and my trustee as Secretary of Health and Human Services, and I was going to have complete access to really... But what happened, just to make a long story short, was in August of '88, I was in New York. There was a shop that many of you, I'm sure, used to be there called Aqua Scutum on Fifth Avenue. There was a red tie with a blue tie with red elephants on it. And I bought that tie and I sent it to Vice President Bush. I said, "Wear this on election day, it'll bring you good luck." And sure enough, election night, I looked on television, he was wearing the tie. So I called him the next day to say, "Congratulations, Mr. President-elect, you did what I told you to do, and see what happened? Congratulations." Now remember, we talked about Monroe, who would be a great secretary. He said, "Oh, Lou, I remember that, but you know, I was thinking, if you'd be willing to do this in about 3 weeks when things have quieted down, if you could come up to Washington, I'd like to talk with you about this." And so I said, "Okay." I hung up what did he mean by that? That does he mean, what do we do to really get Monroe lined up? But maybe I'm kidding myself, but it sounds like he wants to talk with me. And that's the way it happened. So when he said he'd like for me to serve with him, then I was honored. But I told him the things I wanted to do. And he said, well, I support you on those. I said, we need more diversity in the department, both not only racial and ethnic, but gender diversity. And I'm strong on healthy behavior. As you know, I really am very much against tobacco use because of what it does to the health of people. So he said I had his support. So that's what led to my becoming secretary.
We're going to open it up to the audience for questions in just a moment, but I know when you stepped into that role, HIV was exploding at that point. Much controversy around abortion. I mean, you really walked into a hornet's nest.
Yes, I did. In a sense, I tell my friends, maybe it was lucky that I didn't know what I was walking into, because had I known, I might have stayed in Atlanta as dean of the medical school and not gone to Washington. But it was a very volatile time. So far as HIV and AIDS are concerned, the activist groups really thought that the administration was not doing enough. And the activist groups really did not have a good impression of the Reagan administration. And at that time, they looked upon Bush as simply the third Reagan administration since he had been vice president. So they smoke bombed the campus at NIH. They had demonstrations at various places. And I went out to San Francisco to speak at the International AIDS Conference at the Moscone Center. And I was taking a message with me, and I talked to President Bush. I invited him to go with me, because what we were trying to do was to say, this is a new administration. Let's find ways to work together, to cooperate, say, we're not the enemy. Say, the AIDS virus is the enemy. We need to work together to eliminate that. But when I went out to speak at the Moscone Center, because of the picture, the stereotype that existed in the minds of the AIDS demonstrators, when I was introduced to speak, the bullhorns went off, the sirens went off. They started throwing pennies up on the stage and eggs, etc. And so I waited. I had expected a demonstration. By this time, I'd been secretary for a few months, and so I learned already that the Secretary of Health and Human Services is the most picketed secretary of all. And that was because the issues that we deal with are the ones that are closest to people, whether it's abortion or food labeling or Social Security or medical care or other things. People feel closely about that, whereas the Defense Department is dealing with national security, but people tend not to be as emotional about those things. So that demonstration out of the Moscone Center, I waited thinking it would stop after a few minutes, but it went on for 10 minutes. It's obvious to me that they didn't intend to stop. They intended to prevent me from speaking. And at that point, I got very angry. So I got up and went to the microphone, knowing that the people in the Moscone Center couldn't hear a word I was saying because of all of the noise. But I said the people watching on television or listening on radio would be able to hear because I was there at the microphones. Ordinarily, in a situation like that, I would have made remarks of 2 or 3 minutes to try and summarize and then sit down. But I gave my full 10 minutes of all of my prepared remarks because by this time I was really very angry. I'd come out to try and extend a hand of friendship and cooperation, and that was clearly not accepted. But over time, I think we developed a better relationship with those groups. But that was really the life of the secretary, dealing with people wherever they are and trying to get messages across, trying to find where they are and work with them. So that's what we tried to do.
So many more things to talk about, but I'd like to take some time for our audience because no doubt you've got some questions or comments for Dr. Sullivan. And we have some people with microphones, so just if you've got a question, just raise your hand and we'll get a microphone to you. Yes, sir. Microphone's on the way. We have somebody right here. There you go.
Well, thank you, Professor, for your great service. Speaking of the adult literacy programs that you mentioned, that you led, if I'm not mistaken, you use this adult literacy program to put people in medical school. Now, in our city, here in the city of Philadelphia, we are in desperate need of some form of adult literacy program, but not to put people in medical school, to have black people just get their GED. And if I'm, the chance is great. You are here in the free library. We have like 60 branches throughout the city, and we have Tracy Matasek. She could tell you about this problem, the idea of black people in the city who doesn't have GED. I wonder if you could just, this is the problem that we have. We really desperately need adult literacy program.
Yes, that is a problem. It's a great challenge. And there are a number of programs that we have in the Department of Health and Human Services to deal with that, as well as other programs over in the Education Department, starting with Head Start, which is one of the programs in the department, and getting young people, youngsters in their early years into programs, learning how to interact with each other, learning how to read, how to negotiate, how to really articulate what they want to do. One of the things I started as secretary was what was called a minority male initiative, because as many of you know, we have tremendous problems with more black males of high school age in prison than in high schools. So we had launched a $100 million minority male initiative to work with community groups that had a variety of programs to try and have counseling for young men, to really show them that if they focus their energies on productive activities, that'll pay off so that they will become employable. They will really be more in command of their future by that than really choosing a life of crime or violence, et cetera. So this remains a tremendous problem, but I'm encouraged by the fact that there are a number of organizations, both publicly supported and privately supported, trying to address this. This is a major problem that we still, I don't think, have gotten the right answers or the right approach, but I think there's increasing recognition of this. And as you know, President Obama has launched a similar initiative. I think it was a $400 or $500 million program there. So I agree with you that we need to do everything we can to see that young men see opportunity before them and will take the path of really reaching for that rather than a life that is less productive and also risking lives where they end up either on drugs or in jail where their lives will be wasted. We're really bothered by that problem.
Other questions for Dr. Sullivan? Just raise your hand and we'll get a microphone to you. Yes. Okay, and I'm coming to you next.
Could you discuss some of the changes that have taken place over your medical career in terms of specialization of doctors? And I ask because I was reminded when you talked about the man who inspired you to become a doctor. When I was a child, the family doctor did everything. He took out my tonsils and set bones and everything. It seems now we have primary care physicians who are more conduits to specialists. So how did all this come about?
Well, that's a major challenge that we have, but there have been a number of changes in our health system to try and address it. First of all, with the Affordable Care Act's implementation, we have a tremendous need for many more health professionals of all kinds, not only doctors, but more nurses, psychologists, et cetera. And the challenge is to see that people have access to care. For the Affordable Care Act is only part of the question. That's really providing an insurance mechanism. But we have to have more personnel. And we have developed Since my days as a medical student, we've developed physician's assistants and nurse practitioners. In the 60s and 70s, when these fields were first developed and introduced, there was a lot of resistance by physicians and by the AMA. But that fight is over now. I happen to be on the board of Grady Hospital, our local safety net hospital in Atlanta, and we have physicians, assistants, and nurse practitioners on staff. They're well accepted. They do a lot of work and are very much appreciated. And among a number of physicians' private practices, we have the same kind of personnel. Now, in dentistry, interestingly enough, there's a new field of dental therapy that was introduced first in Alaska in 2003. That's an interesting story, but make a long story short, dental therapists have existed in other countries for as long as 90 years, but until 2003 did not exist here in the U.S. The Alaska Native Tribal Council, because of severe problems of dental caries, poor dental health, developed a program to send 20 of their young people, high school graduates, off to New Zealand for 24 months to become dental therapists. They're back, and they're now, I think, close to 100 who have been trained, and they are in these small villages, maybe 10,000, 20,000 people in these scattered around Alaska. The American Dental Association has fought that. They sued the Alaska Native Tribal Council up in Alaska to try and prevent them from doing this. They lost the suit. This program has now been adopted by the legislatures in Minnesota, state of Washington, Maine, New Mexico, and a few other areas. So I think that's going to develop. So that is one of the areas in terms of different manpower. Home care is a growing field now because the shift of site of care has been away from the hospitals into the clinics and now in the homes. We are aging as a population, so the demand for home care will be greater. So having home care assistance would be helpful. That's a growing area there where it's really part health aid, but also an aid working with elderly people in their homes, because most people, when they age, would love to stay in their homes and not go to a nursing home if they can avoid it. So we're going to have a proliferation of different fields, and I think that's good because this will help reduce the cost. We don't need a doctor or a dentist to do everything that is needed. People with less training can often do the same procedure just as good, and this is the same for dental therapists. They do extractions, fillings, fluoride washes, dental education, and so forth. And by studies evaluating them, they do it just as well. So changes in personnel are among them. The technology that's been developed is fascinating. Artificial joints didn't exist when I was a medical student, but now hips, knees, artificial joints are very common. The whole field of sports medicine, repair of tendons, etc. So the field is evolving. What we need to do is learn how to use this technology wisely, because sometimes they're used indiscriminately. There's not as much discrimination as to when it's needed, etc. So that we have to address, because if used properly, not only will we have the benefits of that, but also we'll get better care and there'd be less cost. One of the unfortunate things we know is that within the healthcare system, as much as 25, maybe even 30% of the dollars spent are wasted, either for unnecessary care or fraudulent procedures, etc. If we could find ways to capture that, we could provide more care at no greater cost, and I think we'd all feel good about it. So we have a lot to do, but I think the Affordable Care Act is the start, but we have a lot more to do.
Ma'am, you had a question right there.
You may have answered my question because this gentleman asked about the primary care physician, and in the last century, they were talking about all the doctors were specializing and that there were not very many GPs. And I was on my way over here tonight, and I hear that New Jersey is expecting a shortage in doctors. So I was like kind of worried about that situation, because if one city is going to get a shortage in doctors, then many cities will eventually have that same shortage. But I think you're saying that to fill that gap, we have physician assistants and those types of personnel?
Yes, and let me say, the physician's assistants and nurse practitioners work along with physicians. Oftentimes they may be at the end of a telephone, et cetera, and I think that's fine. The same with dental therapists as well. Because some towns, if you have a town of 5,000 people, that town economically may not be able to support or need a full-time physician. But if you have a physician's assistant or nurse practitioner who can take care of 90% of the health issues that arise, that other 10%, they know how to get that individual to a physician or have a physician come there, that would certainly provide care. And that's better than really not having any health professional at all. So we're getting much more variety among our health professionals, and we have to sort that out so that we have the best possible arrangement to serve the people's needs.
Another question. Yes, sir.
Dr. Sullivan, thanks for your talk. You've referenced the Affordable Care Act a few times. Can you tell us what's your thoughts? I mean, there's been a lot of back and forth discussion as to whether or not it's something that's doing any good for the population. I'd like to get your thoughts. And then additionally, what do you think about the FDA relative to its scorecard and getting pharmaceuticals approved? Where do you think they're at? Are they doing better? What can they be doing in terms of getting more drugs to patients sooner?
Yes. Well, to begin with, I think the Affordable Care Act has shown already it's effective in that there are 11 million more people with health insurance since this act was first implemented a year and a half ago. So that really is a significant dent, because we had some 47 million uninsured people before the act was implemented. And of course, we will see increased numbers as the system is adjusted, because we've had too many states, for example, that have refused to expand Medicaid. Unfortunately, my state of Georgia is one, although 500,000 people in Georgia would benefit by Medicaid expansion, and this would benefit the economy of Georgia. So I think the Affordable Care Act, I'm for that. This is not a perfect bill, and there are a number of things in there that one could quite justifiably criticize. But my position is, rather than working to repeal the act, let's work on those areas that really should be changed or improved. So that's my position. As the wealthiest nation on earth, we should be able to provide basic health care for everyone. And it's not simply a matter of humanitarian perspective. We want to have a healthier population so that people can work, earn wages, pay taxes, be productive, self-supporting, and depend less on social support systems. So that really is the rationale for that. We're competing on an international economy now. The U.S. has been lucky. We've been fortunate in that we have had innovations in our business, in our technology, in our science, so that the benefits have come. But if we are not careful, as we now have we're competing with Brazil and China and India, South Africa, elsewhere. So if we really are not careful and don't work to see that we improve the health of our population along with addressing education too. I'm bothered by the fact that it's much more difficult for a young person now to get a college education than it was years ago. I think that's a great investment the country needs to make in its young people, so that we have people who will continue the Silicon Valleys or the Research Triangles industries, the Route 128 in Boston, et cetera. The return to society is immeasurable. Now, so far as the FDA is concerned, the FDA has a difficult job to do, and of course, as you know, that's part of HHS, so I dealt with that a lot. We expect the FDA to have products released when they are proven to be safe and effective. And so that takes a lot of work and they don't always get it right, and they're under a lot of pressure as well. I'd like to see the process work more rapidly so that drugs can get out. We have worked to get generic drugs out to a greater degree than before. But I also recognize the value of the system that we have in encouraging innovation. We expect our pharmaceutical companies or medical device companies to take great risks in developing a product. It takes $1 to $2 billion to bring a new product to market. And as you know, not all those products succeed. So the system is, if you are willing to take the risk and invest the money and it pays off, then the company gets that return. That makes up for the other products that never made it to the market. And the final comment I would say is the quality of our science is shown by the fact that more Nobel Prizes in physiology or medicine have come to scientists in American laboratories throughout the course of the 20th century than in the rest of the world combined. So that's a recognition of the strength of our science. We still need to work to improve the drug approval process to have it more rapid without compromising safety, and also try to be sure that everyone gets the advantages of those drugs. But overall, I think we've had, in spite of the many problems, we've had a pretty successful system.
We've got time for one last question. So who's got a great question for us to end on? Yes, sir.
Can you talk about a patient's end-of-life issues and the medical, I'm missing the word.
Profession?
Thank you, profession.
Well, this is an important area where there's no one answer. I think the answer about end-of-life care depends a lot on the individual, their philosophy, and their religion. I'm for minimizing suffering and also for more patient autonomy, letting people have more say over what's to happen. I've already, for example, put in my will, I don't want to be kept alive if indeed I have a disease which suffering and there's very little chance of recovery here. But someone else would have a different position. So I believe that the most important determinant or most important person in that is what the patient wants. And because of their own philosophy or their religious philosophy, really I think that should prevail. We are having today more patient involvement in care, which I think is good, and patients playing an active role in their care. And the same, I think, would apply to end-of-life care. Just in today's New York Times, I was reading an article, for example, about kidney dialysis, saying that there are a number of people who, rather than put up with having to be dialyzed 3 days a week, spending a half a day each of those days in dialysis, some people would rather not have dialysis and live perhaps 1.5 or 2 years with what they would consider better quality of life and more productive use of their time. But that's an individual decision. I don't think we can mandate one decision in all of these myriad areas that would fit everyone. So that is how I would approach it.
The book is called Breaking Ground, My Life in Medicine. Dr. Sullivan, thank you so much for sharing your story and so much of your wisdom with us.
Thank you.
Thank you all for being with us tonight. Good night.
Thank you.